Hi everyone, my name is Cecilia Cardenas-Granda, and today we'll be talking about Pathways to Prosperity, a proposed public health initiative which focuses on addressing childhood obesity and food insecurity in Monroe County, New York. So, childhood obesity and food insecurity are closely connected to public health issues that affect millions of families across the United States. And according to the CDC, approximately 1 in 5 children are affected by obesity. Children living in low income households are also disproportionately impacted because many families face barriers to accessing healthy and affordable foods. And food insecurity often forces families to rely on inexpensive, highly processed foods that are calorie dense but low in nutritional value. And over time, this can increase the risk of obesity, diabetes, hypertension, and other chronic diseases. These issues also impact educational outcomes, mental health, long term quality of life, among other things. And this is why we're addressing both obesity and food insecurity together, as it's critical for improving child health outcomes. Monroe County was selected for this initiative because significant health disparities exist across neighborhoods and communities within the county. Many families experience transportation barriers, financial instability, and limited access to grocery stores that provide healthy foods. And some of these neighborhoods are considered food deserts where nutritious foods are either completely unavailable or very unaffordable. And in addition, access to nutrition education and preventative healthcare services is inconsistent for many low income families. These challenges are influenced by social determinants of health, including income, education, housing, and neighborhood environment as well. And because these factors are interconnected, sustainable solutions require collaboration between healthcare providers, school, public health agencies, as well as community organizations. The goal of the program, Pathways to Prosperity, is to reduce childhood obesity and food insecurity among low income families in Monroe County. The program focuses on improving access to nutritious foods, increasing preventative healthcare utilization, expanding nutrition education, strengthening school and healthcare partnerships, as well as promoting culturally responsive outreach. This initiative was inspired by Mexico's Prospera program, which used a conditional cash transfer model to improve health and education outcomes among low income families. And unlike many US programs that operate separately, Prospera integrated financial assistance with healthcare participation and education requirements. And this project adapts some of those ideas into a community based public health model that's specifically designed for Monroe County. A major component of this initiative is the Community Advisory Board, also known as CAB. So, the Community Advisory Board includes public health leaders, school representative, healthcare providers, parents, and community organizations such as FoodLink and the Ibero American Action League. And the purpose is to ensure that community voices remain central to the program planning as well as its implementation, and that the members are the ones who are providing guidance on outreach, cultural responsiveness, accessibility, as well as long term sustainability of the program after the 2 years of the initiative is over. And community participation is essential in public health programs because they're more effective that way when they reflect the lived experiences and needs of the populations that they serve. The program itself would be delivered through partnerships between, as I mentioned, healthcare systems, schools, public health agencies, and community organizations as well. Families could be eligible and enrolled through existing programs such as Medicaid, SNAP, and or WIC, and participants would receive nutrition education, preventative healthcare support, referrals to other community services, and assistance accessing healthy foods. So, kind of a combination of all three programs, taking the best of what is already there. Community healthcare workers would also play an important role by helping families navigate services, coordinate outreach, and support their participation, which is a very different part of the program that SNAP and WIC do not have. And this model focuses on prevention and early intervention while also strengthening the connections between healthcare, education, and nutrition. And to evaluate the effectiveness of the program, both process measures and outcome measures would be tracked. So, meaning process measures would include the number of families that are enrolled, participation in our nutrition education sessions, which would be led by registered dietitians, bilingual registered dietitians, attendance at preventative healthcare visits, and school attendance rates as well. And our outcome measures would include changes in overall childhood obesity rates, reduction in food insecurity, increased preventative healthcare utilization, and improved nutrition knowledge overall. And this data would be collected through a couple different methods, one of them being surveys directly to participants in our program, and also community organizations, electronic health records, school systems, as well as overall community feedback from the community advisory board. And continuous evaluation is important because it allows our program administrators and stakeholders to identify any barriers that are there, improve our services, and also ensure that this initiative remains responsive to what the community actually needs. And although this initiative has strong potential benefits, implementation would also involve or could involve several challenges. Some potential barriers could include limitations to funding after the 2 years are up. So it's sustainability in the program overall. Transportation challenges for participants, coordination across multiple systems could get complicated, and also political concerns related to the conditional assistance program, so that conditional cash benefit that we offer. And to address these barriers, the program would focus on strong community partnership, flexible scheduling, telehealth options, and also overall stakeholder and community engagement. And funding would come from Medicaid partnerships, public health grants, nonprofit organizations, as well as local health care system donations. And continuous quality of the program and also community advisory board oversight would help ensure long-term sustainability and also accountability for all of these goals that we have. And in conclusion, childhood obesity and food insecurity are interconnected public health challenges that require collaborative and community-centered solutions. The Pathways to Prosperity initiative combines healthcare access, nutrition education, and community partnerships, as well as preventative services that could improve child health outcomes in Monroe County. And by adapting evidence-based strategies inspired by the Prospera model, this initiative hopes to reduce health disparities and strengthen long-term family well-being. I'm the proposed program director, and if you have any questions, feel free to contact me with questions, referrals, or any additional resources that you might need. My contact information is on the screen. Thank you so much.